Hello, my name is Sarah Selishi. My contact information, along with my co-authors, is listed below in the bottom right-hand corner if you have any follow-up questions. So we know breast cancer is the most prevalent cancer and leader in cancer-related deaths among women. This study focuses on age of menarche as a previously determined risk factor and aims to identify if any significant correlation exists between the consumption of dairy milk in childhood and the age of menarche. Menarche is the beginning of ovarian activity as it relates to reproduction or the first menstrual period. The age that menarche is reached has been declining over the last 150 to 200 years from an average of 16.5 years old in 1840 to 12.7 years old and below, which scientists believe is the biological limits. This change has been attributed to a multitude of factors, including childhood nutrition. Early menarche has been previously established as a risk factor for breast cancer. Specifically, research published in the Lancet Oncology journal found for every year younger menarche is reached, the relative risk for breast cancer increases by a factor of 1.05. These findings remained even when controlling for confounding variables, including childbearing history, smoking, alcohol consumption, and hormonal contraceptive use. As we know, there are already established links between dietary consumption patterns and cancer risk. Dietary factors are implicated in the diagnosis of colorectal cancer, breast cancer, prostate cancer, gallbladder cancer, as well as others. This research was completed using data collected from a national representative sample of adult females in the U.S. who participated in the 2015 to 2018 National Health Examination Survey, otherwise known as NHANES. And NHANES is a national cross-sectional survey which is continually conducted to monitor the health and nutrition of residents in the U.S. The results of this study found women who had never consumed dairy milk were significantly older by 1.3 years at age of menarche when compared to those who reported more frequent milk consumption. Age of menarche is affected by consumption of dairy milk in childhood, even when controlling for other factors which have been considered as possible affecting agents, including body mass index, family income, race, and education. So age of menarche decreases with an increase in consumption of dairy milk between the ages of 5 and 12 years old. Current U.S. dietary guidelines recommended by pediatricians and followed in school systems continually promote dairy consumption as a healthy and necessary beverage for children beginning at 12 months of age. With the known link between the age of menarche and increased risk in breast cancer, nutritional guidelines for children should be adjusted accordingly for maximum risk reduction, as limiting dairy in the diet of children before reproductive age may delay menarche and subsequent health risks.